Respected chairpersons, ladies and gentlemen, good afternoon to all. I am Cecelia Chetiyaar and I am a faculty member teaching at Maniben Nanavati Women's College, Mumbai. The idea behind my paper is, are spiritual therapies different from psychotherapies? Both come to a similar resolution. So are they different? If they are different, how? And if not, why are they not different? We've seen spiritual gurus around us, and we've seen the part that they have to change people, to help people deal with their past, and to look to the future with a lot of hope. And this kind of a relationship is not just part of a spiritual one, it also happens in therapy. Now, a positive psychology has given us 24 character strengths, 6 virtues. One of them is transcendence, and in this paper I'm going to look at spirituality, which is a character strength for the virtue of transcendence. The idea for this paper came from Saul Rosenzweig's paper in 1936 in the American Journal of Orthopsychiatry, which talks about the common factors in therapeutic healing. And I'll walk you through those 4 factors. The first one talks about not the technique or the school of therapy that you belong to, but rather the unverbalized factors, catharsis, the effect the personality of the therapist has on you, or the client's faith in the therapist and the relationship that they share. The second factor talks about how mental disorder is essentially a disintegration of personality constituents. So if mental disorder is disintegration, then therapy is the reintegration. The therapy provides an ideology, provides a consistent framework with which an individual can reintegrate his life. The third factor Rosenzweig spoke about was about how any psychological event can be formulated alternatively, and it can be reframed in any way, and whichever school of thought you follow, there will be a certain amount of truth in the reframing of that event. The last factor he spoke about was how psychotherapy need not go ahead and regenerate or restore the entire personality at one go. It starts with even one significant factor, and as you start even reorganizing one aspect of the personality, you will find the healing spreading to the entire personality. Now, what does spirituality say? This is the second part of the paper. Peterson and Seligman say that any culture, every culture will have something called a transcendent, sacred and divine force, will have a concept for that. And spirituality by many is believed to be the key and unique function of religion. So how does spirituality relate to these 4 factors? If you're looking at the first factor, I have taken this quote from Sudhir Kakkar. He says that the belief that it is the person of the healer and not his conceptual system that causes the healing, and this is an unquestioned article of faith for most Indian patients. We look to the healer to heal us, not necessarily the God that he's worshipping, because we have Hindus who go to Muslim priests, we have Muslims who go to Catholic priests, and so on. So it's not necessarily the school of thought, but the person. The second factor they talk about is the formal consistency. Now, whichever religion you follow, the precept that is followed by the religious healer is something which has been passed down over the years, over centuries in fact. So there is a solidification of that theoretical concept. It allows the individual to reintegrate the scattered parts of his life. And if you're talking about alternative formulation, you're also saying that traumatic events can be reinterpreted. Again, I've just given the example of when something goes wrong in our life, we say we are paying for it with it's probably pichle janam ka paap, or we are paying for it, it's your karma and things like that. So you have religion also explaining, giving an alternative explanation for events in your life. The last factor, yes, I'll give you the example of forgiveness. I may need not talk to an individual and ask him to change his entire lifestyle, but I could ask him to let go of his past by probably taking just one concept, forgiveness. And if an individual is able to just let go of probably someone who hurt him in the past, he's bringing healing into one part of his life, which is spreading to different parts of his life also, and therefore reintegration of personality is happening again. What is the relationship between spirituality and psychotherapy? Therefore, I will refer to Jerome Frank in 1981 when he spoke about the common features for all effective therapies, be they spiritual-based therapies or psychology-based therapies. The first thing he says is the relationship is emotionally charged and it's a confiding relationship. It occurs in a healing setting, And it provides a plausible explanation. It provides a schema, a framework for the patient to understand his symptoms, and it also prescribes a ritual or a procedure. If you are following a religious technique, you will be following a ritual. If you go into a psychotherapist, he will give you a procedure. He will give you some exercises. And also, both the patient and the therapist believe that this ritual or procedure will bring about healing. So what is the benefit of having spirituality identified as a character strength? Again, these points are taken from Peterson and Seligman, and in their studies they found that young people who are spiritual or religious, you find lower drug use, alcohol use, smoking. They have positive benefits for relationship. They practice virtues like altruism, volunteerism, kindness, and forgiveness. They are broadly associated with the ability to cope with stressful life events. In fact, there's an entire section on the different coping lifestyles, which I will not go into because we don't have the time. So what am I trying to say here? We all know that the role of the psychologist, of a counselor, is being more accepted. The stigma is slowly being washed away. And if you're saying that therapy is producing effects similar to spirituality, spirituality creates resilience and tolerance. I'm saying therapy also creates resilience and tolerance. Therapeutic relationships can therefore build stable personalities. And if you're building stable personalities, why not also stable nations? And both therapy and spirituality, they function as catalysts. What will they create? A nation of individuals who are successful at being happy and not just struggling to be happy with their success. Thank you for your time, and I'm open to questions.
Thank you, Cecelia. You were very much in time.
Thank you. Anybody?
Questions? I think it was a very thought-provoking paper, so I would see a few hands. Yes? Somebody raising the hand there? I think I'll take the privilege to ask a question.
Sure, ma'am.
Yes.
Whether they are beneficial, firstly I'll take that part of it. There are individuals who, when they have gone through extremely traumatic circumstances, have experienced what you're saying, out-of-body experiences. They have felt they are outside the situation and they have observed it. And they felt they were able to deal with it. And if you're asking, does it also happen in the therapeutic situation? Frequently, if you're talking about situations where the therapist will ask the client to step out of himself and observe the situation, I would say that's the psychological equivalent of, I'm assuming, is the psychological equivalent of an out-of-body experience. Basically, you are viewing the situation from the outside. Did that answer your question? Yes, ma'am?
Any other question? I would like to ask a question.
Sure, ma'am.
There is one more, yes.
Yeah. Yes. Right. I'm not sure I follow your question. More certain schools of therapy which produce more success in certain cases. Right.
Okay.
Right. When you're talking about the different schools of therapy, it is a given that certain schools of thought are more appropriate for certain disorders, like you yourself just said. The researches that I have come across comparing the success in a spiritual relationship against the success in a psychotherapeutic relationship, so far of all the reading I've done, I haven't seen a comparison. Maybe my reading is limited, but I don't have any research which has actually compared the two.
Thank you, Cecelia.
Your question, ma'am, you wanted to ask something?
I'll keep it reserved.
All right, thank you. Thank you for your attention.